My name is Dr. Aashish Chaudhry. I am the Managing Director of Aakash Healthcare, Super Speciality Hospital, New Delhi, Dwarka. Post-COVID, there has been a lot of changes which the private healthcare organizations have seen. If I talk about in general, I would say they have become much more conversant with the safe practices, the patient safety practices, and also the hand hygiene. That practice has become a commonplace. Just like we have seat belt becoming a norm for all the automobile drivers. The hand hygiene has taken a, even without any motivation, every healthcare professional is focusing upon that, and it has become a part of life. Apart from that, we have seen the spectrum of disease, is changing. The awareness of the population at large is changing. So their expectation from the healthcare organization is all-time high. They are very observant. They are very careful in terms of the treatment advised. And also, I've seen that when it comes to selecting a doctor or an organization, so not just the name and fame of the clinician is important. There are so many other things which come into play, like how the hospital is maintaining the support services, the cleanliness, and even the air changes. People are talking about air changes in the hospital, and especially about the ICU care, where somewhere we want a positive pressure, somewhere we want a negative pressure. So these things have become very commonplace because of the education received by each one of them, whether online or in face-to-face during the COVID times. So private healthcare has to gear up for this, and yes, every organization is on that path. And whosoever is not able to match up, I think it will be very difficult to survive in post-COVID times if you are not very vigilant for emerging diseases, post-COVID complication, which we call it long COVID disease. So this is still going to stay for many years. And I feel that as a responsible healthcare organization, we have done our bit, and we are continuously evolving to take care of all the post-COVID challenges, and also the new spectrum of disease and newer viruses. But we are very much aware now. The moment we get a new virus or new disease or an epidemic hitting back, our protocols, which have been well oiled during the last 3 years, they start immediately, and we are very well in position to take care of any such eventuality. Those changes which we adopted during the COVID times, barring the absolute segregation of the COVID and non-COVID wards and the areas, those things have gone because we don't see so much of spread of the disease. But yes, the donning and doffing, the ICU care, the segregation of the infected patients of any, for that matter, any infectious disease, not just COVID. So that is still in practice, very well enforced and accepted by each one of the staff. So it has become a culture at the organization. If you talk about other things, yes, the support service is now playing a very significant role. The type of material used for the sterilization of all the surfaces where patients or the attendants or the staff come into contact. So that regularity in cleaning and sanitization is all-time high. Then there are usage of ultrasonic cleaners during the off timings. So that also helps in sanitizing the environment. Apart from that, the process and protocols related to operation theatre, the ICU, they have been upgraded to, even if we miss on any COVID disease, which since we are not actively testing every patient, so the likelihood of transmission of disease is significantly reduced. Global expansion for Aakash Healthcare, it happened by a chance. We never thought that we are going to explore beyond North India or Delhi NCR to begin with. But due to the regular influx of patients from neighboring countries, especially Uzbekistan, to India for seeking medical care, over the last 3-4 years, we have been actively treating patients coming from this country. And in that process, we realized, and there have been many episodes, more than 10 or 12 episodes, where we have gone back to that country to give care and do the regular medical camps and surgical camps in the country. We realized that there's a lot of gaps when it comes to healthcare delivery in that part of the world. And during this our to and fro movements, we realized that why not bring up a center which can at least start giving primary and secondary level of care, so that for every small little medical issue, patients should not be traveling to India and spend 3 times more money. And in that process, in fact, we got a very good response from the regulatory authorities, the government, who is very actively seeking Indian healthcare partners to come over and help the country upgrade the healthcare facilities, or be partner in one of the major healthcare facilities. They are willing to provide all kinds of support in terms of employees transfer, the settlement, the family issues, whatever. So we, after going through all these positive messages from the government, from the local partners, and a great response from the patients, so we decided to look for a healthcare facility, and last 2 months we were able to close that. But it was a long journey to actually study law of the land and comply with all the regulations, and also the norms of the Indian government and RBI to do a foreign investment. After doing all those due diligence, taking adequate legal advice and accounting firm advice, we have gone back and taken over the complete shareholding of a already running healthcare facility in the capital city of Tashkent in Uzbekistan. The good thing is that the government is aware of it, and they are trying very hard to get people on board. So they are not just talking to Indian healthcare partners; they are talking to Korea, Turkey, and many other countries. In fact, Korea has been investing a lot in Uzbekistan in terms of healthcare space. There are a lot of pediatric problems. There are a lot of mother and child issues. So, in fact, one major area which we found was the hepatitis problem in the country because of their cultural and other reasons. So, and that leads to a lot of liver and kidney issues. So, the upside from the government support, it is very good. Downside, we feel that is huge amount of opportunity. I felt that what the kind of care we were delivering maybe 1 or 2 decades ago, that is a situation there in the country. And I think if we go with the right intention and with a good supervisory staff, we should be able to not only provide care to begin with, and also train the local doctors and nursing staff and upgrade them to come up to the same level. And ultimately, the country will be benefited.